Good morning, everyone. It's MP Erica with Mantra Aesthetic Studio in Virginia Beach, Virginia, and I have another sensationalized news headline for you. Now, this sensationalization of this news headline is not necessarily because it's giving out wrong information. I just wanted to make a few clarifications and get into some of the shocking details of this case. So let's get into it. Before we get into the fine details of the story, I did want to clarify one thing. The title of the article says she posed as a surgeon. You don't actually have to be a surgeon in most states to do these procedures in office legally. A liquid BBL, which is adding a biostimulator into your bottom to build collagen. With that being said, you can be an RN, a nurse practitioner, a PA, or MD, not necessarily a surgeon. A licensed healthcare professional is trained on the appropriate techniques to do these type of higher risk procedures. And also, if there are any complications, they are trained and have the resources to help. So the article reads, seeking to enhance her figure, Miss Ayala, who's now unalived by Miss Castillo, turned to Castillo, a fake surgeon who injected silicone into Ayala's buttocks and thighs. The procedure turned fatal when Ayala died from an embolism, a direct result of those injections. So an embolism is a risk of any injection procedure. We can call it a vascular occlusion or an embolism if it's actually like a piece of fat that actually breaks off and gets into a blood vessel and it travels to your heart or lung and it occludes blood flow. And that's how you can die from these type of procedures. And the craziest part about this whole story is Miss Castillo was caught doing this before in 2011 in Manhattan. It reads here, as we allege, Waleska Castillo put the health of unsuspecting women at risk, all to make a quick buck. She compounded the danger in which she placed her clients by allegedly discouraging at least one woman from seeking medical attention after she developed complications from the injection. Okay, and the document goes on. It says, although the FDA has approved certain forms of silicone for cosmetic use, it has prohibited the injection of liquid silicone or silicone gel to fill wrinkles or augment tissues anywhere in the body for public and health safety reasons. Tissue augmentation using silicone injectable fillers has resulted in death and serious injuries in both the United States and abroad, especially when injections are performed by unlicensed practitioners and outside of a clinical setting. Risks associated with such injections include permanent lumps within the skin, infections, skin ulcerations, and potentially fatal pulmonary blood clots. You guys, it is not worth it to try to save money on something that can kill you like this. I mean, I do see a lot of people, and I don't want to get on the soapbox, but a lot of people going out of the country to get surgical procedures like BBLs and all that stuff, or going to somebody's house to get silicone injections just to save a couple $1,000s. But I will tell you that you will have a tough time if you come back to the U.S. with complications, getting someone to help you outside of the ER, because providers see this as a legal liability. They don't know what was done to you, and they're not sure how to help in that instance. So the only place that can help you is the ER. And when does the ER help? When it's an emergency. So you could literally be suffering in pain or with wounds or with oozing or infection until it's deemed an emergency and the emergency room decides to do something about it. Okay, let's wrap this up. Let's move on. So Miss Castillo has been doing this since 2009. She doesn't hold a medical or nursing license of any kind in the United States. She was getting liquid silicone from the Dominican Republic and administering in the breast and buttocks for enhancements. She administered these injections in her Bronx home. Red flag, red flag. Telling women that the injections are safe and charging them hundreds of dollars per injection. One woman who paid Castillo $1,000 for injections experienced pain and shortness of breath following procedures and fainted within hours of the procedure. After being revived by her boyfriend, the woman called Castillo to report her medical symptoms. Castillo discouraged the woman from seeking proper medical attention, saying that a hospital would not help because the procedure was illegal. Girl. So she just don't learn. She just don't learn. And then after this last time, she only got 4 years. So she got 4 years in jail after being caught twice. Whew. Make it make sense. Anyway, all right, one more thing, y'all. Look at the bottom right. Look at the bottom right. Look right here. Y'all y'all see this? Crazy glue. Yeah. If you ever walk into a facility or a home or something and somebody has crazy glue and they're going to use it on you, run. I don't think I should have to say that. I don't want to feel like I'm bashing anybody, but bro, listen. She used crazy glue to close the wounds. Don't they sell liquid Band-Aids over the counter? I mean, why not the liquid Band-Aids? If anything, you're going to get crazy. If I had a wig, it would be flipped back. I just can't. I just cannot. Thanks for listening. If you have any comments, go ahead and drop them below. I just thought this was very interesting because I just really want people to know. I just really hate that this might ruin somebody else's experience who wants to get a liquid BBL, because they might see this first. And this is not the case for most people that get BBLs by licensed professionals. There are hundreds of thousands of these procedures done in the US on patients that are happy and that love their results with FDA approved products. So if you ever are looking for a liquid BBL, you can come to Mantra. Okay, I will do a consultation with you, or find someone that's local to you that does the liquid BBL, someone that's licensed. Don't be afraid to ask questions and just be an advocate for yourselves. Thanks for watching. Take care. Have a great day.